Hi everyone, welcome to Competitive Pharmacy. Today we are going to deal with the MCQ on biopharmaceutics on the chapter absorption. First question, passive diffusion is otherwise known as option A, non-ionic diffusion, option B, ionic diffusion, option C, neutral diffusion, option D, none of these. Correct answer is option A, non-ionic diffusion. Passive diffusion is otherwise known as non-ionic diffusion. Question number 2. Passive diffusion is expressed by option A, Fick's first law of diffusion, option B, Michaelis-Menten equation, option C, Fick's second law of diffusion, option D, both A and C. Correct choice is option A, Fick's first law of diffusion. So, passive diffusion is the diffusion movement of drugs from region of higher concentration to lower concentration without using energy. So, it is expressed by Fick's first law of diffusion. So, what is Michaelis-Menten equation? It is commonly used model for enzymatic reactions, enzyme substrate complex, which leads to the synthesis of product and release of enzyme, that is denoted by Michaelis-Menten equation. So here the correct choice is Fick's first law of diffusion. Passive diffusion is expressed by Fick's first law of diffusion. Question number 3. Which of the following is or are true regarding passive diffusion? It is also known as non-ionic diffusion. Option B, it is non-saturable. Option C, depends on the square root of molecular size of drugs. Option D, all the above. So, in first question we have seen passive diffusion is otherwise known as non-ionic diffusion. So, this statement is true. It is non-saturable. So, we have seen that passive diffusion is the movement of drugs or substance from a region of higher concentration to lower concentration. So it is non-saturable. It is a non-saturable process. So concentration did not have any effects on it. After a particular concentration, there is no change in passive diffusion and all. So it is non-saturable. So it depends on square root of molecular size of drugs, whether it is true or false. It depends on square root of molecular. This passive diffusion depends on square root of molecular size of drugs. So option D all. So the correct choice is option D, all the above. So this passive diffusion process is an energy independent process, non-ionic diffusion process, non-saturable process, and depends more or less the square root of molecular size of the drugs. Molecular size in between 100 to 400 Dalton can be effectively absorbed passively. Upper limit for drug molecule for passive diffusion is 600 Dalton. It is very important. So upper limit for drug molecular size for passive diffusion is 600 Dalton. So once again I repeat, it is a non-ionic diffusion. It is a non-saturable process. It depends on the square root of molecular size of the drugs. Upper limit for passive diffusion is 600 Dalton. Second, fourth question. Intestinal absorption of vitamin B1 and vitamin B2 is by option A, facilitated diffusion, option B, passive diffusion, option C, active transport, option D, endocytosis. Correct choice is option A, facilitated diffusion. Facilitated diffusion is the process of spontaneous passive transport. It's a type of passive transport. It is a spontaneous passive transport. So the molecules transport via a specific transmembrane integral proteins. So vitamin B2 B1 is absorbed by facilitated diffusion in pharmacological dose. At pharmacological dose, by facilitated diffusion, vitamin B1 and B2 are absorbed. Next question. Dinitrophenol, cyanates, fluorides inhibit which mechanism of drug absorption? Option A, active transport. Option B, facilitated transport. Option C, passive diffusion. Option D, all the above. So this dinitrophenol, cyanates, chlorides, this inhibit the transport of drugs which require energy. So option A, active transport require energy. So energy requiring transport are inhibited by dinitrophenol, cyanates, chlorides. Next question. Macromolecule substances are absorbed by the mechanism of option A, carrier mediated transport, option B, passive diffusion, option C, endocytosis, option D, none of this. Correct answer is endocytosis. Endocytosis is a type of active transport that require energy. That moves particles such as large molecules, part of cells, and even all cells into the cells. These are different variation of endocytosis, but all share a common characters. Plasma member of the cell invaginates, forming a pocket around the target molecule. So if suppose this is a particle, so the cell form a cell vaginate and forming a pocket around this target molecules and around this target particle and engulf that is known as endocytosis. It's a type of active transporter. Next, absorption of calcium occur in the body by the mechanism of option A, active transport, option B, facilitated diffusion, option C, phagocytosis, option D, pinocytosis. So the correct answer is option A, active transport. So absorption of calcium occurs in the body by the mechanism of active transport. So active transport, glucose absorbed by active transport. Glucose absorbed into our body by active transport, whereas glucose enter into RBC by facilitated diffusion. Next question. Identify the wrong statement regarding the characteristic of carrier mediated transport. Option A, it has specificity. Option B, it is non-saturable. Option C, occurs at specific site. Option D, none of this. So it has specificity. Carrier mediated transport having specificities. A specific carrier is needed for specific substance to be absorbed. For example, vitamin B12 absorbed through the body by a specific intrinsic factor, carrier mediated. So it has specificity. Like lock and key mechanism, it has specificity. Then it is non-saturable. Whether it is non-saturable or not. Passive diffusion, we have seen that it is non-saturable. But here it depends upon the amount of carrier present in our body. So it is saturable process. So this option is correct. So incorrect. So identify the wrong statement. So this is the wrong statement. It is non-saturable. It is actually the saturable process. So next point, occurs at specific sites. Obviously, it occurs at specific sites in the intestine. So that is true. B, none of this. So only the wrong statement. The wrong statement in this option is a non-saturable process. So option B is the correct answer. Next question. Rate limiting step in the bioavailability of drug through extravascular route. What is extravascular route? That is by oral route or other non-parenteral routes. These are known as extravascular routes. Option A, absorption. Option B, excretion. Option C, metabolism. Option D, none of these. Correct answer is option A, absorption. So by extravascular peroral route or other than intravascular route, the bioavailability of drugs depends upon the absorption of drugs. Next, question number 10, last question. Orally administered Sabine polio vaccine, large protein molecules, botulinum toxin are absorbed by mechanism of option A, pinocytosis, option B, facilitated diffusion, Option C, passive diffusion. Option D, none of this. So orally administer drugs like large protein molecules, these botulinum toxins, these are absorbed by the mechanism of pinocytosis. These are fluid-like substances. So endocytosis, two types are there. Endocytosis, two types are there. And phagocytosis and pinocytosis. So pinocytosis is known as fluid eating. Fluid eating. So phagocytosis, solid particles are absorbed by phagocytosis. Cell engulfed in, uh, the substance is engulfed by the particle by phagocytosis. Uh, then fluids are engulfed by fluid eating. These fluids are engulfed by pinocytosis. So the orally administered 7 polio vaccine is in fluid shape. Large protein and botulinum toxins. These are absorbed by the body by the mechanism of pinocytosis. Hope you like this video. If you like this video, please like, share and subscribe. Thank you for watching.